sternochumeral joint, which gives the shoulder its rounded contour. The deltoid muscle is divided into three parts: the anterior deltoid, the middle deltoid, the posterior deltoid. The posterior deltoid originates, proximal attachment, from the spine of the scapula. Next, the middle deltoid originates from the acromion. Finally, the anterior deltoid originates from the lateral third of the clavicle. The deltoid inserts distal attachment at the deltoid tuberosity of the humerus. We can see that its innervation comes from the axillary nerve C5-C6. The primary action of the deltoid muscle is shoulder abduction beyond the first 15 degrees. The initial 15 degrees are carried out by the supraspinatus. The posterior part of the deltoid takes part in shoulder extension, horizontal abduction, and external rotation. The anterior part of the deltoid takes part in shoulder flexion, horizontal adduction, and internal rotation. To strengthen the deltoid, utilize shoulder abduction exercises such as lateral raise and shoulder press. To target the posterior deltoid, use exercises like high row or shoulder horizontal abduction. To target the anterior deltoid, use exercises like shoulder flexion. To stretch the posterior deltoid, hold your arm in shoulder horizontal adduction. To stretch the anterior deltoid, hold your arm in shoulder